Elysium Healthcare is a national provider of independent mental health services. We provide a diverse range of services, including mental health services for adults and young people, as well as neurological services. I think our core ethic is really to provide services that work in partnership with the NHS and local needs, and that really drives what we do.
We're here to talk about new care models, which is something as a company we're very committed to in terms of our specialist secure services and our CAM services in relation to working, as our commitment is, to work with the NHS. New care models for us is an opportunity to integrate our services more fully into local provision, improving pathways, providing better access to care and meeting the needs of the population that we look after in a much more joined up way.
There are challenges, and it's right to focus on the challenges, but I think also the starting point is that actually there's much to recognise in terms of achievement. I think services have a will to work together, and I think there's a universal view that things need to improve in terms of better care locally and providing a more holistic approach towards care across care pathways. Clearly, the underlying issues are around legislation and the way that we organise services so that there aren't seamless pathways and funding streams that support that. And also, of course, the challenges that services have in terms of chronic underfunding and trying to meet new ambitions within that regard.
You could add in workforce, obviously for us is also, and for the NHS, it's a major issue in terms of your service redesign. So our ambitions to create new ways of working, to bring services and capacity into local areas. Workforce is sort of front and centre, probably just slightly behind the finance is the big issue.
Well, we're really pleased to support this event, but I think from our perspective, we're really here as active participants in terms of delivering good care. So, the theme that we're presenting about is no chance. It's about working more closely together with NHS providers, community agencies, and actually learning about what is working well, and I think thinking about ways about how we extend that.
Sharing knowledge is always critical, obviously. Meeting people at conferences like this allows you to widen the base in terms of who's aware of things and programmes, particularly around things like new care models, which at its core requires the third sector, local authorities, social care commissioning, a whole range of people to be plugged into what's going on. And it's an opportunity to share that. And for that, in itself, is enough, really, in some respects. It's also good because, already we've meeting new colleagues who do bits of the role that we're not necessarily aware of before, or you weren't necessarily thinking of meeting today, such as like architects and people like that. The continuing commitment to patient health. I think we're too, sometimes things like parity of esteem can be used as a sort of blasé statement, but underpinning the delivery of better care is better holistic care. And it was good to hear from Public Health England yet again in relation to the commitments, some of which seem like funding commitments from the centre to actually help and support people's care.